How to treat and cure chronic obstructive pulmonary disease. The goals of treatment for COPD are to slow down the disease by quitting smoking and avoiding triggers, such as air pollution. Limit your symptoms, such as shortness of breath, with medicines. Increase your overall health with regular activity. Prevent and treat flare-ups with medicines and other treatment. Pulmonary rehabilitation, rehab. Pulmonary rehabilitation, rehab, can help you meet these goals. It helps train your mind, muscles, and heart to get the most out of damaged lungs. The program involves a team of health professionals who help prevent or manage the problems caused by COPD. Rehab typically combines exercise, breathing therapy, advice for eating well, and other education. Self-care. Much of the treatment for COPD includes things you can do for yourself. Quitting smoking is the most important thing you can do to slow the disease and improve your quality of life. Quitting smoking. Other things you can do that really make a difference including eating well, staying active, and avoiding triggers. To learn more, see Living with COPD. Medicines. The medicines used to treat COPD can be long-acting to help prevent symptoms or short-acting to help relieve them. To learn more, see medications. Other treatment you may need. If COPD gets worse, you may need other treatment, such as oxygen treatment. Oxygen treatment. This involves getting extra oxygen through a face mask or through a small tube that fits just inside your nose. It can be done in the hospital or at home. Treatment for muscle weakness and weight loss. Many people with severe COPD have trouble keeping their weight up and their bodies strong. This can be treated by paying attention to eating regularly and well. Help with depression. COPD can affect more than your lungs. It can cause stress, anxiety, and depression. These things take energy and can make your COPD symptoms worse. But they can be treated. If you feel very sad or anxious, call your doctor. Surgery. Surgery is rarely used for COPD. It's only considered for people who have severe COPD that has not improved with other treatment. Dealing with flare-ups. COPD flare-ups, or exacerbations, are when your symptoms shortness of breath, cough, and mucus production quickly get worse and stay worse. Work with your doctor to make a plan for dealing with a COPD flare-up. If you are prepared, you may be able to get it under control. Don't panic if you start to have one. Quick treatment at home may help you prevent serious breathing problems. A flare-up can be life-threatening, and you may need to go to your doctor's office or to a hospital. Treatment for flare-ups includes: don't smoke. The best way to keep COPD from starting or from getting worse is to not smoke. There are clear benefits to quitting, even after years of smoking. When you stop smoking, you slow down the damage to your lungs. For most people who quit, loss of lung function is slowed to the same rate as a non-smokers. Stopping smoking is especially important if you have low levels of the protein alpha-1 antitrypsin. People who have an alpha-1 antitrypsin deficiency may lower their risk for severe COPD if they get regular shots of alpha-1 antitrypsin. Family members of someone with alpha-1 antitrypsin deficiency should be tested for the condition. Avoid bad air. Other airway irritants, such as air pollution, chemical fumes, and dust, also can make COPD worse, but they are far less important than smoking and causing the disease. Get vaccines, flu vaccines. If you have COPD, you need to get a flu vaccine every year. When people with COPD get the flu, it often turns into something more serious, like pneumonia. A flu vaccine can help prevent this from happening. Also, getting regular flu vaccines may lower your chances of having COPD flare-ups. 7. Pneumococcal vaccine. People with COPD often get pneumonia. Getting a shot can help keep you from getting very ill with pneumonia. People younger than 65 usually need only one shot. But doctors sometimes recommend a second shot for some people who got their first shot before they turn 65. Talk with your doctor about whether you need a second shot. 2 different types of pneumococcal vaccines are recommended for people ages 65 and older. Pertussis vaccine. Pertussis, also called whooping cough, can increase the risk of having a COPD flare-up. 8 So making sure you are current on your pertussis vaccinations may help control COPD. COPD gradually gets worse over time. Shortness of breath gets worse as COPD gets worse. If you are diagnosed early, before you have a lot of lung damage, you may have very mild symptoms, even when you are active. If you are diagnosed later, you may have already lost much of your lung function. If you are active, you may be short of breath during activities that didn't used to cause this problem. If you are not very active, you may not notice how much shortness of breath you have until your COPD gets worse. If you have had COPD for many years, you may be short of breath even when you are at rest. Even simple activities may cause very bad shortness of breath. It's very important to stop smoking. If you keep smoking after being diagnosed with COPD, the disease will get worse faster, your symptoms will be worse, and you will have a greater risk of having other serious health problems. The lung damage that causes symptoms of COPD doesn't heal and cannot be repaired. But if you have mild to moderate COPD and you stop smoking, you can slow the rate at which breathing becomes more difficult. You will never be able to breathe as well as you would have if you had never smoked, but you may be able to postpone or avoid more serious problems with breathing. Complications. Other health problems from COPD may include more frequent lung infections, such as pneumonia. An increased risk of thinning bones, osteoporosis, especially if you use oral corticosteroids. Problems with weight. If chronic bronchitis is the main part of your COPD, you may need to lose weight. If emphysema is your main problem, you may need to gain weight and muscle mass. Heart failure affecting the right side of the heart, cor pulmonale. A collapsed lung, pneumothorax. COPD can damage the lung structure and allow air to leak into the chest cavity. Sleep problems because you are not getting enough oxygen into your lungs. Palliative care. Palliative care is a kind of care for people who have a serious illness. It's different from care to cure your illness. Its goal is to improve your quality of life not just in your body but also in your mind and spirit. You can have this care along with treatment to cure your illness. Palliative care providers will work to help control pain or side effects. They may help you decide what treatment you want or don't want. And they can help your loved ones understand how to support you. If you're interested in palliative care, talk to your doctor. For more information, see the topic palliative care. End-of-life care. Treatment for COPD is getting better and better at helping people live longer. But COPD is a disease that keeps getting worse, and it can be fatal. A time may come when treatment for your illness no longer seems like a good choice. This can be because the side effects, time, and costs of treatment are greater than the promise of cure or relief. But you can still get treatment to make you as comfortable as possible during the time you have left. You and your doctor can decide when you may be ready for hospice care.